In the previous lectures of bleeding diathesis, bleeding disorders, we have discussed different causes of abnormal excessive bleeding related to vessels, related to platelets, and those related to coagulation cascade. Today we'll discuss a dreadful complication of some of the diseases which also leads to excessive abnormal bleeding. Well, as far as coagulation bleeding is concerned, normally a balance is maintained between procoagulant activity and the anticoagulant activity. About procoagulant activity, we know that this is the activity, phenomena, situations, and substances which try to maintain, which try to make the clot. We try to maintain the clot when the vessels are severed, when injury occurs, that to stop bleeding from the severed vessels, procoagulant activity, procoagulant substances, they act. While on the other hand, there are some anticoagulant activity within the blood normally, and normally to make the blood flow in the liquid state within vessels and to uh, stimulate the process of clotting in the situation of severed vessels. A balance is maintained between these two forces so that a normal status quo is maintained. About we know the procoagulant activity, and normally the anticoagulant substances in the blood, they are number one, the antithrombin 3. This is the major anticoagulant activity, and it controls the action of thrombin. Number two, heparin cofactor 2. It also inhibits the action of thrombin. Number three, the protein C. It is the inactivator of activated factor 5 and activated factor 8. And number four, the plasma fibrinolytic system. Well, in plasma fibrinolytic system, there are some plasminogen activators. Plasminogen activators which activate the plasminogen, and plasmin is formed. And among the plasminogen activators, there is tissue plasminogen activator, urokinase, streptokinase, staphylokinase, and vampire bat plasminogen activator, and some others. And once the plasmin is formed, it degrades fibrin clot into small fibrin threads, very small fibrin threads, which are called fibrin degradation products. Fibrin degradation products, FDPs, which is a substance which in itself antagonizes the action of thrombin. So the in plasma fibrinolytic system, plasminogen activators are there which convert plasminogen into plasmin, and plasmin digests fibrin to limit coagulation, and FTPs are formed which in itself have antithrombin action. So with the help of these inhibitors of coagulation, normally balance is maintained between these two forces, and the normal function of coagulation and the clotting, it goes on. Well, consider a situation when there is abnormal activation of coagulation cascade. Well, during some diseases, uh, there are situations when there is abnormal activation of the coagulation cascade, and when there is abnormal heightened activation of the coagulation cascade, what will happen? It will lead to formation of microthrombi throughout the body within small vessels. That is, within small vessels throughout the body, the microthrombi are formed, and these microthrombi, at times they may be limited to one organ or a tissue, and uh, at other times it is generalized. And this condition, where there is formation of microthrombi within small vessels throughout the body, is called disseminated intravascular coagulation. And this disseminated intravascular coagulation, abbreviated as DIC, is a big, dreadful complication of many diseases, many abnormalities. For example, some of the disorders which lead to formation of DIC, they are: number one, obstetric complications. Obstetric complications like abruptio placentae, retained dead fetus, septic abortion, amniotic fluid embolism, and toxemia of pregnancy. These conditions, these diseases, these disorders, at times they, their complication is the formation of small microthrombi within small vessels throughout the body. That is DIC. The second group of disorders is infections. Gram-negative sepsis, meningococcemia, malaria, histoplasmosis. They at times can also lead to the DIC. The next group is number 3, neoplasms, like cancer of the stomach, cancer of pancreas, cancer of lung, and cancer of the prostate. They, one of their complications may be DIC, and similarly, acute promyelocytic leukemia. So at times, the severe complication of acute promyelocytic leukemia (M3) is the DIC. Now, number 4, massive tissue injury. Whenever there is massive tissue injury, uh, for example, the traumatic injury, very severe trauma with crushed injuries, or extensive surgery or burns, they can lead to the formation of microthrombi throughout the body, that is DIC. And some of the other disorders, diseases like acute intravascular hemolysis. About acute intravascular hemolysis, or snake bite, or shock, heat stroke, aortic aneurysm, they can also lead to DIC. In each of these cases, the mechanism of formation of DIC, the mechanism of production of DIC, they are uh, different. Different mechanisms are involved in their production of DIC. And what about the pathogenesis of DIC in these disorders? Mainly two major mechanisms are involved in production of DIC. One is release of tissue factor or thromboplastic substances, release of large amount of tissue factor or other thromboplastic substances into the circulation. And what they do is they start the bleeding cascade. They start, sorry, not the bleeding cascade, the clotting cascade. They start the clotting cascade mostly through intrinsic pathway. And the second mechanism is widespread injury to the endothelium. And whenever there is widespread injury to the endothelium becomes more sticky. The more and more adhesion molecules are expressed on the surface of the endothelium. Platelets adhere there, platelet aggregation occurs, and later coagulation occurs there. And in this way, DIC is produced. Well, pathophysiology of DIC, the underlying mechanism, as I described, they lead to systemic activation of coagulation. And whenever there is systemic activation of coagulation, it may lead to, on the left, enhanced fibrin formation. Definitely, the coagulation will lead to enhanced fibrin formation, which lead to microvascular thrombosis. That is, within small vessels of the body, small thrombi are formed, and whenever small thrombi, large number of thrombi are formed within the vessels, and this will lead to hypoxia, ischemia, rather this will lead to ischemia of the organs, ischemia of the tissues, and organ failure. While on the right side, by systemic activation of the coagulation and formation of microthrombi throughout the body, what happens? Consumption of platelets and clotting factors occurs. Consumption of platelets and coagulation factors will lead to deficiency of these substances and obviously will lead to bleeding. So in DIC there are two main things. One, the formation of thrombi within small vessels throughout the body, and secondly, there is tendency towards abnormal, excessive, prolonged bleeding. What is the pathophysiology of DIC? Easy to understand. Whenever there is on this left side massive tissue destruction, whenever there is massive tissue destruction, it will lead to release of large amount of tissue factor. Similarly, this in the middle sepsis will also lead to release of large amount of tissue factor. And whenever there is release of large amount of tissue factor, it will lead to stimulation of the cascade, clotting cascade. And whenever there is stimulation of the clotting cascade, it will lead to widespread microvascular thrombosis. And on the right side, whenever there is extensive endothelial injury, it will lead to platelet adhesion, platelet aggregation, and activation of the intrinsic pathway, and it will also lead to widespread microvascular thrombosis. And widespread microvascular thrombosis in itself is plasminogen activator, and plasmin formation occurs, and this plasmin formation will lead to fibrinolysis. And here in the middle, widespread microvascular thrombosis will lead to vascular occlusion, and vascular occlusion will lead to, on this left side, tissue ischemia with organ damage. Tissue ischemia with organ damage will occur, and here on the right side, microangiopathic hemolytic anemia. What is microangiopathic hemolytic anemia? You must be knowing this. That is, blood while passing through the crevices of this crevices of thrombi, widespread thrombi, there occurs hemolysis. And in this way, microangiopathic hemolytic anemia occurs. And here, this widespread microvascular thrombosis on the right, the platelets, clotting factors, they are used up. Their consumption occurs and their relative deficiency occurs there. And when plasmin is formed, fibrinolysis occurs, and when fibrinolysis occurs, small fibrin is cut off into small pieces, and this is called fibrin degradation products. Fibrin degradation products or FDPs. The quantity of FDPs goes on increasing and increasing, and FDPs in itself, increased amount of FTPs in itself leads to inhibition of thrombin because they have got antithrombin activity, inhibition of thrombin, platelet aggregation inhibition, and fibrin polymerization. That is inhibition of thrombin formation, thrombin action rather, platelet aggregation and fibrin polymerization, and these all will lead to bleeding diathesis, will lead to a tendency towards excessive abnormal prolonged bleeding. And the fibrinolysis and the plasmin formation also leads to proteolysis of clotting factors, because clotting factors are after all they are also proteins, and they are cleaved up, and proteolysis occurs by plasmin formation, and this also leads to decrease in clotting factors, deficiency of clotting factors, and finally leads to bleeding diathesis. And on this side, right side, the widespread microvascular thrombosis leads to consumption of platelets and clotting factors. So it will lead to deficiency of platelets, deficiency of clotting factors, which will definitely lead to bleeding diathesis. So uh, two important things. One, the formation of small thrombi within small vessels throughout the body, and secondly, there occurs tendency towards excessive abnormal bleeding, that is bleeding diathesis. DIC is most likely to follow. These also among the causes of DIC, these three, they are more important, and DIC is most likely to follow. Number one, the obstetric complications, and in obstetric complications, mostly there is the DIC occurs due to release of excessive thromboplastins. In obstetric complications, a large number of thermoplastins are released into the circulation, which lead to DIC. And DIC leads to hypoxia, ischemia, and this leads to endothelial injury. And so the both causes of DIC, they work together, that is release of thromboplast into circulation and endothelial injury. Secondly, the malignant neoplasm. In malignant neoplasm, especially in adenocarcinomas, what happens is that the mucus-like substance is released into the circulation, which act as thromboplastic substance, which act as thromboplastins, and they activate the intrinsic coagulation cascade and leads to microthrombi throughout the body. And thirdly, in sepsis, especially in gram-negative bacteria, what happens is on the left side, one thing, antigen-antibody complexes are formed. Antigen-antibody complexes are formed. Their formation is activated, which lead to formation of intravascular thrombi. And in the middle, endotoxins which are formed in gram-negative sepsis. Endotoxins, they act like thromboplastins and lead to intravascular thrombi. And also the endotoxins, they decrease the quantity of protein C, which will lead to intravascular thrombi formation, that is, which will lead to what is called excessive coagulation. And on this right side, gram-negative sepsis also leads to endothelial injury, and endothelial injury, whenever is there, will lead to intravascular thrombi formation. So this is the mechanisms involved in DIC production in some of the disorders. The morphology of the disease, how the disease presents, or this complication presents, along with the causing, along with the signs and symptoms of causative disease, there are thrombi in all tissues, small thrombi in all tissues, in the brain, in the heart, in the lungs, in the kidneys, in the adrenals, in the spleen, in the liver, and they will produce signs and symptoms according to the organ involved. In the kidneys, there are small thrombi in the glomeruli, and when the condition is very severe, it leads to microinfarcts in the kidney, or even bilateral cortical necrosis can occur. And in the lungs, the thrombi occur in alveolar capillaries, and when there are thrombi in alveolar capillaries, pulmonary edema occurs, that is, aggregation of fluid out into the alveoli, a pouring of fluid into the alveoli, so the pulmonary edema occurs. And exudation of fibrin leads to hyaline membrane formation on the alveoli, which definitely will lead to respiratory distress. So the morphology of the disease, that is the signs and symptoms and presentation, is according to the involvement of the organs, according to the involvement of the tissues, and according to the severity of the abnormality. In the CNS, microinfarcts will occur, or fresh hemorrhages can occur into the brain. And when this occurs, bizarre neurological symptoms can occur according to the site of the brain involved. In meningococcemia, if adrenals are involved, hemorrhages occur into the adrenals, and a condition, a syndrome, can be produced at times called, which is called Waterhouse-Friderichsen syndrome. Waterhouse-Friderichsen syndrome, in which some of the hormones produced by adrenals, their deficiency occurs. If pituitary gland is involved, affected especially in toxemia of pregnancy, it leads to the one syndrome, Sheehan syndrome. So when pituitary gland is involved in DIC, Sheehan syndrome may be the result. Clinical course of the disease, clinical course of this complication, it may be acute as it occurs in endotoxic shock and amniotic fluid embolism, or it may be insidious, its onset may be insidious, as occurs in carcinomatosis, that is different types of carcinomas, and retained dead fetus. The clinical features, there are two groups, thrombotic complications, they lead to ischemia, infarction, and organ failure. And secondly, due to consumption of platelets and coagulation factors, the bleeding diathesis can occur. Bleeding diathesis can occur or can dominate. The exact picture depends upon the particular situation and the organs involved. Usually, it is said that 50% of the cases they occur due to as obstetric complications, and 30% cases of DIC they are due to carcinomatosis. And this is how the patients look like in which the complication, dreadful complication like DIC occurs. Thank you.